Dr. Patel first. Can you explain what you're picking up? First, let's just talk about the problem itself and everything that you're seeing around you, hearing people who are talking to you. Explain, Professor Patel, what is it that you're picking up about the kind of impact the second round of COVID infections is having on the mental health of Indians?
I think it would be fair to say that what India is experiencing on a scale probably never seen before is a giant humanitarian crisis. And I think we can really refer to the large body of evidence from other humanitarian crises to understand what's happening in India at the moment. And I'd really say there are two broad issues that we should consider. What's happening at the level of the entire population, the sweeping anxiety and fear, for example, of contracting the infection, and more importantly, that is twinned with the sense of, well, the usual comfort we have on people we trust collapsing around us. And then you have a specific subgroups in this population who have disproportionately been affected by the pandemic, and I'm sure we'll talk about them, but just to flag them up, first of all, we must acknowledge the unique needs of people who survived COVID, particularly those who have had acute respiratory problems or had essentially been put on a ventilator. The second is young people who have been blocked out of their schools for more than a year now. And the third is women who have found themselves in a very patriarchal society, locked into their homes, not only having to deal with work, but also with their kids and with other domestic responsibilities.
Now what has happened now is an unprecedented, completely something that we can't relate to, can't adapt so easily, has hit us and hit us hard, and it's affected us across the board. Like today, if you would talk to any individual, especially in affected areas, it's virtually impossible that they would have not had a direct experience, which is a family friend or a colleague. Now that's something that is very significant. What that does is, it brings you an anxiety. The most basic anxiety, would I be fine? Would my family be fine? And then that starts playing on your mind.
Do you foresee though some element of chaos in the early days, because apparently in this particular round you have to get a vaccine only through registration, there can't be walk-ins. Is your portal in a position to accept the vast load of people who will come in this 18 to 44 age group to register starting today?
Two questions you asked. One is whether the portal is capable of taking the load of the people who are going to register on the system. We think so, yes. Of course, one makes estimates only. And we are expecting at least 10 million, 12 million registrations on the platform today itself. And we are ready for that. So that's one question. Secondly, as you know, as they come on board, and thereafter they will be able to, make the appointments as and when the appointments open. We have also opened the APIs of the platform, wherein people will not have to log in every time to look at the vacancies. They can look at the vacancies independently from the login, and that will make it better and more user-friendly for people to look at the vacancies.
We have seen overcrowding even in this first and second phase in various vaccination centers. And now the fear which is being expressed by doctors is that many of these vaccination centers themselves are turning out to be super spreaders.
Nevertheless, I continue to answer you, and the answer to this question will be that this is precisely for the reason that we do not want the chaos to take place. That is why we are insisting that please go only after you got an appointment.
1 crore registrations. What's the road ahead likely to be from the 1st of May? Dr. Mahajan, 1 crore have registered between 4 p.m. and 8 p.m. Sir, is that an indicator that vaccine hesitancy is either not there or is it on the decline? But are we prepared, sir? Are we prepared to vaccinate people between 18 and 45?
The very fact that the CoWIN app has been capable of registering 1 crore people in one day and as per you in 4 hours means that it's a very robust system, and whatever glitches may have happened, those will be sorted out. 1 crore is a huge number, and that the country has been able to produce an app which is capable of handling this kind of traffic is amazing. Now let me delve into how I understand the new policy. in the new policy, the central government is going to procure 50% of all doses, and these are going to be given to the states to carry out through the government hospitals vaccination for 45 plus, something that has been on since the last few weeks. So nothing is going to go wrong as far as the current vaccination program in the government hospital goes, because this is going to be free of charge and this is going to be dose which is ensured by the central government.
Now the issue is that I'm little skeptical about it. Now you see the avalanche of people are coming. You know, registration of 10 million people over a period of 4 hours means a lot to us, under the backdrop of fact that the manufacturing capacity of our both the companies is not more than 8.5 million per month. And this is a registration on the other side. It is a registration to the tune of almost 10 million in 4 hours, and we have 2 more days to go for 1st of May.